Physicians at San Antonio Orthopedic Specialists are committed to advancing the practice of medicine, advancing through research as well as through development of implants and instruments. So I'm holding here is a simulated femoral component of an artificial hip. This bump out here is called the greater trochanter. That's the bump you feel on the side of the leg, well below the belt line. And this will be the ball of the ball and socket joint. There are a number of muscles that pass by or attach to the trochanter, and these muscles can give rise to pain localized over the trochanter. Now, most people who have pain in this area, and it would be, for example, a Trochanteric Bursitis or an Iliotibial Band Syndrome, these are fancy medical terms for it hurts here. Most of these patients the problem can be resolved with either injections and usually physical therapy or exercises, stretching and strengthening. However, some people don't respond to that, and we don't entirely have the answer as to why. There's a small cluster of nerves on this part of the bone, on the backside, that seem to play a role in persistent trochanteric pain. So right now we're involved in a study, and we are the first site for this study, to effectively inject ice. Now that sounds a little bit funny, but there are mechanisms where you can inject something that's very cold into the warm body, and it will stay cold for a while. Now what does that do? Well, it damages the nerves here so they can't send signals of pain to the brain. And that's expected to last 3 months to a year from the time you get the injection. And so if this works out, some people who do not respond to physical therapy or to ordinary style injections might respond to this cold therapy and then be able to live a much more active life. We're actively recruiting patients for this study. If you think you might be a candidate, please let us know.